Hello everyone, I'm back here at CSA Medical Aesthetics. You probably watched me on one of Dr. Contessa Salvador's YouTube channel, and recently last September I had my nose filler done here at CSA Medical Aesthetics. And for the advanced level of enhancement, Doctora is going to use threads for my procedure. And of course, don't forget to click the like button, subscribe, and the notification bell beside the subscribe so that you'll be notified whenever Dr. Contessa do have a new video.
Good day everyone! Welcome to the CSA Certified Skin Authority. In today's episode, we have a returning guest. Let's all welcome Miss Kelly Canoza. Welcome back!
Welcome back.
Yan. So if you recall, we did a non-surgical procedure of nose enhancement for Kelly. It was the radius dermal filler. That was about 5 months ago, right? And we have a very important question right now because a lot of our televiewers are also asking. The question was, when is the best time or when is the safe time to add again another product
or
for nose
enhancement?
enhancement? So that's a vital question. So we have received those questions from those comments, or some of our clients are calling us or sending us emails. Kailan po ba pwede magdagdag, mag-repeat, mag-add on?
Yes.
Okay. So, and yung kailan po ba pwedeng pataasan ulit? Kasi for others, it's still there, but they want it higher. Or is that possible? Or is it safe or not safe? Yan. Pero before we answer that question, let's ask Kelly, kamusta naman yung experience after the radius dermal filler?
To be honest, wala po ako na-feel na masakit or anything. I just do swell a lot. Sobrang namamaga talaga yung skin ko.
Yeah, I recalled that.
Yes. But for my mom, she told me that the procedure was perfect.
Yeah, I recalled kasi Kelly, when we did the injections
Yes.
nung ating radius dermal filler, after inserting the cannula and then pushing the radius product, then pulling it out, then instantly, nakikita ko na nagsiswell up na siya. Tapos, when we also have done yung tip projection, siyempre yun, insertion yun to the deepest part, anterior nasal spine,
Yes.
then pushing the product, ganyan, we already noticed then
The swelling
Then,
itself.
and that time, we took pictures.
Yeah.
Meron naman siyang instant result.
Yes.
So, we've noticed yung elevation, we've noticed yung tip projection, plus yung alar narrowing. Very obvious naman sa kanya kasi yung before and after photos niya during that time, yung kanyang bridge part, kasi dati, it was really, it lacks definition, right?
Yes po.
After the radius dermal filler, nag-angat siya
Yes.
instantly, naglaman. Yan lang may kasamang swelling din
My only mistake po is I drink coffee po nun. I drank coffee, which is not allowed pala if you're going to have a procedure.
Yeah, no, kasi caffeine, it's a caffeine. More of a vasodilator din ang caffeine eh. So, we also tell our clients to avoid yung mga blood thinners before doing procedures.
Like aspirin, clopidogrel,
exactly. Or, I tell also my patients to stop muna vitamin E, ginkgo biloba, fish oils. Yun.
But Dr. the inflammation before was managed naman po.
Yeah, actually, after naman yun.
Kaya nga nandito siya
ilang
ulit.
days lang yung swelling mo?
5 days.
Oh,
Ayun.
5 days lang. The
It's
others
actually
na
one repair na.
Yeah, the others naman 1 week ang
Ayun,
swelling.
7 days.
Pero we also have patients,
Oo.
they never swell.
Oo, case-to-case basis talaga,
bruise at
Dr.
all, no swelling. They send me pictures the next day. Parang wala. Natural lang. So, those are lucky people. So, we have people who tend to bruise. There are people who don't bruise at all. There are people who swell a lot or who swell less, or those people who don't swell.
Yes,
Ako,
that's
I was swollen for a few days after my hypnose. Pero that was a year ago na. But then yung sa akin, yung thread ko, I can still palpate it here in my radix. 1 year na. Andito pa siya.
Hindi pa siya nag-hydrolyze, Doc.
It hasn't hydrolyzed or it's not dissolved yet. I can still, ayan no, nag-grasp ko pa sa ito, thumb and index finger, grasp na grasp ko pa siya. Meron pa. Kasi I use also pure Hyco PCL that time. So, ngayon, pag-usapan natin, the answer to that important question. So, when do we add on? Or when do we repeat? Or when do we re-enhance? Okay. So, we've done this 5 months ago.
Yes,
Right?
September at
So, meaning to say, parang 5 months ago, parang ngayon, pwede na tayong mag-repeat. Well, the one we used was Radius Dermal Filler, and it's made of calcium hydroxyl apatite crystals. Andun pa yung mga calcium hydroxyl apatite na yon. The calcium phosphate minerals kasi yan, bone minerals,
Yes.
they're actually in a carrier gel. So, nung in-inject natin yung filler, meron siyang gel, yung CMC gel.
Yes.
But that carrier gel, siya yung mauunang madidissolve. Usually, they start to get dissolved in 3 months' time. Yung parang pinaka-liquid vehicle or carrier.
So, yung kaha, Doc,
Right.
yun yung...
That's the first one that's gonna dissolve. Now, yung calcium phosphate crystals mismo, hindi pa. So, andyan pa yung mga crystals or microspheres na yon. They are still stimulating the fibroblast cells to make new tissue proteins. Okay? So, that's why I'm looking at Kelly, meron pa rin yung shape eh. Andun pa rin. Okay? Elevated pa rin. Pero kasi Kelly and actually even I still wanted to project pa. Diba? You also wanted to somehow enhance pa. Tapos, further defined it eh.
Yes po.
Siyempre, we want what's best for us.
Yes.
Minsan lang kasi ilang taon ka na? 20?
Turning 23.
Wow, advance happy birthday. Ayan. Minsan ka lang ganyang 20s, why not look your best, di ba?
Yes po.
Ayun. So, we still have the calcium phosphate crystals. Now, is it safe to add another type of material? Well, the answer is, as early as 3 months, you can already add.
Okay.
You can already re-enhance. Okay? There was a study done na yung first layer mo na in-apply mo inside, you can add after 3 months, parang you do second layering of what was injected in the previous or during the first treatment. So, yun.
So, as early as 3 months talaga, Doc, no?
Possible na.
Yes,
Although,
that's good.
I had cases as early as a month,
Gustong-gusto na i-enhance.
come back.
Oo.
As long as there's no swelling, there's no problem, no infection na or no acne or no active lesions,
Mga nodules, mga papules.
Exactly.
Oo.
Everything is okay. The tissues are okay.
Yes.
Then we can add more, particularly the thread materials. Or even nga filler, you can add more.
Pwede.
But
Same
then,
filler ba, Doc, ang
You
gagamitin?
can also make use of the same filler
Yes.
again. You can
Oh, that's
add
good.
on. Yeah. Or you can put also hyaluronic filler. Okay, you can add on. So these are materials inside the tissues, hyaluronic, the calcium minerals.
They can
have
see
them
inside us, no?
all together inside.
Yes.
Exactly.
We're biocompatible.
Biocompatible pa rin yan. The calcium phosphate, hyaluronic.
Yes.
they're inside, right? So, compatible na compatible. Hindi sila magiging, what do you call that?
Mag-boxing.
Contraindicate
Yes.
each other or parang counter reaction.
Yes, that's why it's safe, Doc, na
It is okay.
to put again.
It's okay.
Because of their biocompatibility.
Exactly. Now, at this time, okay, the question again, what kind of product can we use? Since we did filler already, for now, I would really recommend using na mga protein threads.
Ah, yes.
Okay, to further stimulate the tissues also. And para mas i-define pa yung kanyang nose. Mas i-elevate, mas i-project, okay? Or somehow parang sharper looking pa. Or much pointy, right? Much may dating.
May dating.
Okay, meron ng dating, lalo pang may dating.
Much contouring on your
Exactly.
nose. No?
Let's give more impact to it. Okay. So, in today's episode, we'll be using a thread that's been well known already actually and approved. Okay. We can still use, actually you can still use the radius dermal filler. But for now, we wanted nga, yun nga, gusto pa natin talagang well-defined, talagang magstay siya, steady siya sa gitna, at saka sharper looking. It's much better to use na the threads.
The threads talaga.
Okay. So the kind of the thread that we will use today will be a polydioxanone or PDO thread. So we've already used that in the previous episodes. We have presented already the so-called YCO. Okay. We have YCO threads that are also polydioxanone or PDO. These PDOs have been used for a long time already. They're approved and they're very safe. Also biocompatible types of threads. Absorbable materials, and then when you place them inside, it's not gonna cause any strange or no catastrophic complications, okay? Kasi take note with the fillers also, be careful ang ating mga televiewers also. Sa mga dermal fillers po, huwag po kayong basta-basta nagpapa-inject ng dermal filler, especially sa ilong, because of mga blood vessels that are in our nose region. Importante that the doctor is very aware of the anatomy of the blood vessels and very experienced.
That's
actually, Tanungin nyo rin po ang inyong, well actually, the thing is, if the doctor has been doing it for a very long time, maraming beses na, naka-encounter na siya ng iba't ibang klase ng nose. Kasi, hindi po pala pare-pareho ang hugis ng ating ilong, magkakaiba.
Yes, gender differences and also yung mga kung Asian ka, Caucasian ka, iba-iba yung lapad,
iba-iba anatomy. Iba-iba rin yung shape. So, parang ano lang yan yung mga sapatos size, parang hindi tayo pare-pareho ng size. So, hindi magkakamukha-mukha. Yan. And some people also have a different kind of desire for their nose. Yung iba gusto nila mild na height lang. The others naman really wanted talagang very high. So, yun. We also take into consideration ano yung gusto ng bawat isa.
Patient satisfaction.
And the important thing for me, when I do it in my clinic, symmetry. Balance. Kasi baka naman gusto niya mataas na mataas, hindi pala bagay sa mukha niya yung sobrang taas. Diba? There are some people na ang taas-taas ng ilong, hindi pala bagay. Symmetry, proportions, balance, that's the real beauty. Okay? So, ayan. Natuto tayo. Okay.
Thank you.
So, I think we'll be showing yung actual procedure. We'll be using our YCO PDO
threads.
Okay? So, we'll show that when we return. And we're back, mga ka-CSA. So, we're about to do the nose re-enhancement for Miss Kelly. We will be using the PDO polydioxanone YCO threads. Okay? So, step 1 actually is always clean the area. Okay, yan yung tinatawag na antisepsis. And then after that, we have to numb the skin. A while ago, we applied a topical anesthetic cream. We left it for about 45 minutes. So we applied the cream on the tip of the nose up to the bridge region. Okay, now we also need to inject lidocaine again for our entry point. So the entry point will be the infratip region for our long cannula PDO thread. So I will pinch the tip of the nose. Inhale, exhale lang, Kelly. Okay, injecting the lidocaine. Okay, there you go. Then after that, we have to make an entry point for our PDO threads. So we'll have a gauge 19 needle here. So I have to follow the center of the philtrum, and then this is an entry point. Okay. So I recall before, Kelly, you were a bleeder, right? When you puncture, so there's some bleeding. And then I'll use my first PDO thread, then insert into the entry point. Sponge, please. So ideally bevel down, okay? And then I'm just gonna push this upward to the bridge up to the radix region. So renion and then the radix part. So I'm using a PDO thread that is 60 millimeter. So my second one of PDO towards the radix of the nose. I'm staying midline, and my anatomical depth is a deeper depth as much as possible. Stay in the center and then go deeper into the periosteal and perichondral region. Meaning to say, on top of the bone and cartilage of the nose. Okay, avoiding the superficial layer. You don't want the threads to be very visible on top. Okay. So how many threads already?
5th thread.
Okay. So this is our 5th thread. Or
6.
Okay. Now we can check after inserting 6 threads. Okay, we can actually add more. By the way, I recalled, Kelly, when we were doing your nose filler in the past, I noticed on the renion you have this bump.
Yeah.
Yeah. And it was a problem we have corrected already. We did a balancing on that one. Then you can use the threads also to align, or rather make the nose straight, because some people have skewed nose, not straight nose, so the thread will be able to help to straighten up, or together with the dermal filler too. Okay. Now we can proceed to our tip projection. So we are proceeding to the nasal tip projection. I'm using this 40 millimeter PDO thread, Wyco. So I'll pinch the columella and insert this 40 millimeter PDO thread up to the anterior nasal spine. Okay, there you go. Then we'll use a second 40 millimeter PDO thread into our columellar region, inserting up to the anterior nasal spine. That's the second one. Okay, so our goal is to have a nasal tip projection as well as narrowing the alars of the nose. So if you want to have a less rounded nose, for those people who have a so-called bulbous tip or a more rounded nose, then this is a remedy to somehow narrow that. Or those with wide alars, we can already narrow the alars with this nasal tip projection. So this will be my last for my tip projection. Again, pinch the columella so that I can feel for the entry of the cannula in between this thumb and index finger. Okay, there you go. So we have done injections of our PDO threads, Wyco 60 millimeter and Wyco 40 millimeter, to enhance our bridge as well as the nasal tip. So we have done the non-surgical nose enhancement for Kelly, making use of our Wyco PDO threads. So let's show the result to Kelly. So here's our mirror.
The magic mirror.
Wow!
Right.
Are you satisfied naman?
Sobrang ganda po.
Yeah. It's a lot better right now, Kelly,
Yes.
because we were able to also narrow your nose, make it slimmer
It looks smaller din po.
and smaller.
Parang lumiit
Exactly.
po siya.
Yeah. Because the ideal nose also for women is narrower, slimmer, okay? And on the tip, it's projected. So looking at the nasofrontal angle, there's around 130 degrees. And then in the nasolabial angle, I could say it's like a 100 degrees or 95 degrees. Okay, so those are the ideal angles that we follow. And if I'm gonna do like an assessment dun sa tinatawag na rule of thirds, so it's in the middle third of the face, right? So tamang-tama lang siya, naka-level siya, yung dito sa may
Glabellar.
Exactly, glabellar and eyebrow region, and then the subnasale. And then if you do the rule of fifths, yung vertical naman, so within the center fifth of that vertical dimension. Okay, a while ago when we were doing Kelly, her nose is as before. She bleeds. She tends to bleed. Okay, and we are trying to control the bleeding at the tip region. And we have placed this tiny dressing here to close the opening. Okay, but normally the opening will also close later on.
Yes.
Yung iba, sandali lang, few hours lang, it's gonna close na. And then you just have to do ice compress. Now, the color white, yung blanch na white na yon, those are lidocaine injection. Okay, so in review, we have used about 10. Tama, Doktora?
Yes po.
10 60mm PDO threads. And then, we added 40mm also for the nasal tip. Actually, I wanted to correct yung supra-tip break. Kasi it's normal for some of my patients, they were asking me about the groove yung dito sa lower third of the nose.
Yes.
That's the junction between the bone and the cartilage. So it's normal na yung connection na yon, there's actually a slight dent or a groove. So we can also correct that with our PDO threads. And then going to the tip region and columella, we were able to project it forward. Okay? So, kanina kasi medyo yung naka-downturn pa. So, medyo na-upturn natin, medyo na-lift natin forward. And because of that lifting, you're trying to increase the tip projection, nag-narrow yung sides, yung
Yes, the
alars
columella. Ay, the alars.
Nag-narrow na po yung sides ni Kelly dito because of the tip projection. Kasi yun nga yung goal natin, right, Doctora, when we do the non-surgical rhinoplasty, we wanted to elevate
The radix projection.
Exactly.
Yes.
And then you wanted to somehow lengthen the bridge.
Yes.
And then also you wanted to lift the tip or project the tip, and then the narrowing.
Alar narrowing.
Yeah. Making use of our Wyco PDO, 60mm and 40mm length. So we have variable lengths for these threads kasi the others have shorter nose. So we have to also use medyo shorter length of thread. That's why when we insert it, sometimes yung iba, dahil so short nose, yung thread, minsan merong lumalabas dun sa tip. So we have to just remove that or cut it.
Yes.
Kasi if it's not removed, the tip opening will not close. So it will not heal. So it's also important, make sure when you do procedures like this, make sure that there's no thread coming out. Otherwise, it will not close, it will not heal.
Yes, for that not healing, Doctora, will parang magkakaroon ka ng secondary bacterial infections.
Yun. So we have to avoid that.
Yes.
So kailangan talagang make sure after the procedure that there's no remaining thread or thread coming out or extruding out from the nasal tip. So Kelly, let's hear from you. What's your reaction? What is your message to our televiewers?
Hello to all the CSA viewers. Ako po, Doktora, personally, this has been my insecurity kasi since dati. And I think po yung high-cut threads, parang mas contoured siya tignan kaysa sa fillers. And I really advise muna po na magpa-assess lahat.
Yes.
And mag-direct po kayo talaga dito sa center nila, not just online messaging po.
You're correct in saying that. So with the thread talaga, in addition, talagang mas nakokontour mo siya, mas nabibigyan mo siya ng dorsal line. Kasi with the filler, well, it's also good. The filler is very good also for nose lifting and giving volume eh. Yun lang, kung gusto mong medyo mas may line sa gilid or sharper looking, use the PDO thread. And another thing, I recalled kasi when we were doing the radius dermal filler, remember we noticed yung bump mo sa isang side?
Po.
Yun yung nagkaroon ako ng difficulty in doing the balancing. So we inserted also yung portion dun sa kabila na parang dent Kasi yung kabila, may bulge. May bony bulge. And now, while we were doing her, parang na-correct rin yung bulge na yun. So that's a good thing with the radius dermal filler naman. I think it also helped in kind of giving that volume in the area na may dent. Because these are calcium phosphate. That's why nung in-insert na natin yung mga threads, nagstay lang tayo midline center eh. And then, mas straight na. So yung may mga problems na skewed nose, mapapansin niyan yung mga girls when they do their dorsal line, nose line, parang hindi nga straight. Yun, actually, defect ko rin yan. Pag nagla-line ng ganyan, parang
may contour, may parang crooked.
Crooked siya. Yun, tama. That's the word, crooked nose. So with this PDO threads, we can already make it straight, make it center aligned.
Yes. Could be corrected naman pala na.
Di ba? A lot better now?
Yes po.
So, pa-improve na ang ating mga treatments, especially for Kelly. O, yan. So, nasagot natin yung mga questions a while ago. We have discussed so many issues, so many things. Yung kailan pwede, safe ba, kung magpapadagdag pa, or the others naman are asking, kailan po ba yung pwede po bang matagal? Pwede po bang, kasi I'm working abroad, like, I'll only come back after 2 years. After 2 years, still okay. May iba pa, after 3 years. Yan, it's fine. No worries about that. Yun lang yung concern din nila. Doktora, yung syempre pagkawala na yan, yung magbababa na. The thing is, when it's already dissolved, of course, medyo mag-decrease na yung height, but somehow, it has a remnant. Meron siyang naiwan na fiber tissue.
There's a formation of the fiber tissue.
Yes. So, meron doon. Kaya, it's better to add earlier eh.
So, as early as 3 months, sabi niyo daw kanina.
Para yung first layer mo, nilagay mo na, then yung layer again, second layer mo na, para mas ma-boost mo yung tissue formation. So, it's still okay. Like, the others, hindi makabalik. Like, after a year, 2 years, 3 years, okay pa. Okay pang magpa-threads din. It's safe. Wala naman itong magiging problem or anything na that's gonna be bad or dangerous to your health. Okay? So, there's no catastrophic devastating complications. No serious side effects to these kinds of procedures. They're totally safe. Okay. So, wala ka ng tanong, Kelly?
Wala na po.
Are you happy?
Yes, super happy po.
No more
Very
inputs,
happy.
Doctora?
Of course, post-care, no? For the punctured site, syempre magko-close din yan.
Right.
But you don't put any makeup for 3 days, like that. Then you can go with ice compress every 4 hours, 6 hours. For the bleeding naman, maybe we could manage it with medications later on.
Okay.
In case of pain, we could have pain medications naman. No need. We just take note of your allergies in case for that.
Yeah, ideally, mas maganda nga wag mo nang maglagay ng anything. Although the entry point was just here, pero the others naman close earlier.
Yes, Doc.
Merong mga
Case-to-case basis talaga.
Okay na. Actually, nung ako, the next day, I put on my
Makeup.
makeup na. I did mine, but then I have to put it on na. But then, nag-close naman na. I just did an ice compress. Oh, ayan! Maraming salamat, Kelly.
Thank you po.
Doctora.
Thank you po, Doctora.
And sa inyong lahat, maraming salamat po. Kung meron silang katanungan, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the 2nd floor, Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat, Pampanga. Contact number 0933-860-9193 or 0917-504-4268. We also have our FB, CSA Derm Centre, and Instagram, CSA Derm Centre. And please do not forget to watch our other videos. The YouTube channel is Contessa Salvador, and please do not forget to click like and subscribe as well. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.